Recently in the news, there have been reports of drug overdoses in nursing homes, and most of them have been in Kansas. Now, they're not all in Kansas, they're all over the U.S. and the world, but Kansas is the leader of nursing home overdoses in the United States. So basically what these nursing homes are doing is they are giving antipsychotics to calm mentally unstable, potentially dangerous to themselves, patients down, to calm them down, instead of having to confine them in a room and watch them 24/7 or strap them to a chair or something of that sort. And to be honest, those aren't really very practical or very humane. But the problem is, instead of giving them the right amount, they are prescribing overdoses for these patients, and their health is getting worse instead of getting better. Now, there are people who are trying to solve these problems or help the problems, and in Kansas there's a group called the Kansas Advocates for Better Care. Now, what the KABC is proposing is two different things. First, informed consent. Now, I'm really surprised that in general nursing homes aren't already doing this. And I say in general because I'm sure some nursing homes around the country are already doing this, but in general nursing homes aren't doing this. So basically what informed consent is if the patient cannot make a decision for themselves because they are mentally unstable, a relative of that person is selected to make a decision for them. So whenever the nursing home wants to give them a drug or a treatment, they have to run it by that selected person and get an okay from them. The second thing the KABC is proposing is trying the alternates before just automatically giving them drugs. They're proposing things like behavior intervention techniques and musical therapy. Now, my family is really into healthy eating and dietary supplements like vitamins and things like that. I propose that they should give them healthier food and give them those dietary supplements and see if those help, and actually they have been proven to help, and they can actually cure or prevent cancer or Parkinson's or dementia and things like that, and the problem is hardly any people know that. So I definitely agree on the informed consent, and like I said before, I'm really surprised that it's not already done in general. And I really do think they should try the alternates before just automatically giving them the drugs. I think the problem in today's day and age is that someone will have a problem and they'll say, oh, I've got this problem, I gotta go take this drug, or I've gotta go take this antibiotic. The problem is the drug might solve that one problem they have, but it'll create 2 or 3 more others. That they'll take a drug for that, and then it'll create 2 or 3 more other problems, they'll take a drug for that, and it's just a constant chain of taking drugs and antibiotics, and they're just not helping anything. So I think if people just ate healthier and took dietary supplements, the world would be a lot better place, health-wise at least. So I hope you learned a lot from watching this video, and I hope you enjoyed.